Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Hey guys, welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital, joined by Dr. Cameron today. I'm your host, Grant Otten. Doctor, how are you doing?
Good, how are you, Grant?
Good, glad to sit down with you, and we're talking about your field, which is being a hospitalist today. Can you talk a little bit generally, what is your job? I guess, what do you do?
Yeah. So the big part of what our job is anytime anybody gets admitted to the hospital, is that we take care of them in the hospital.
Okay.
We manage their diagnoses, we set a treatment plan for them, we discuss the treatment plan with their primary care doctor, and then when it's time to discharge the patient, we set up all the follow-up appointments and communicate with their primary care doctor with what happened in the hospital and what the plan is moving forward.
And I think when people think of specifically the kind of type of care that you provide, they might think of like a family practice doctor. They might not even associate that with someone who actually works out of the hospital. Why did you decide to kind of work here in the hospital?
Well, it's the reason I got into it is really I found that when I went through my training at the Nebraska Medical Center is that I liked taking care of patients in the hospital.
Yeah.
The hospitalists here at Columbus Community Hospital are internal medicine trained, which is similar to the family practice. But we are internal medicine trained.
Okay.
It's a little bit different focus in residency.
And talking about a lot of doctors, obviously, I would say probably the vast majority are specialists or do some kind of, they have some specialty and they just really focus on, maybe it's the foot and ankle or something like that. Why did you decide to steer away from something that was really specialty and decide to, like you said, it seems like you just like to take care of everybody?
That's a good question. I think what I really liked is using all of my training.
Yeah.
When you go into a specialty, you do focus on that specialty, whether it is cardiology or gastroenterology. And I liked the whole picture. And so that's why I ended up in hospital medicine. It's a shorter training as well, which plays a role. I mean, I think that you have to realize that it's 3 years training rather than 6 or 7. And so it is a really nice field to get into right after residency. I really enjoy what we do, and so I don't think that I'd have a desire to go back and specialize, but I know there are other physicians that want to do that. So.
Yeah. We'll talk about that training and stuff. You talk a little bit about your educational journey, I guess, and how you kind of ended up here in Columbus.
Yeah. So I have a little non-traditional background.
Okay.
I was a banker before I went back to med school, and
nice.
My wife was in physical therapy school at the time when I was a banker, and I would help quiz her on some of her studies and found that I really had an interest in the medical field. So I did some job shadowing and decided that my personality fit best with being a physician.
Okay.
So I went back and did some prerequisite work, and then went to med school at Nebraska Medical Center and did my residency there in the internal medicine department. And now I'm here. So.
That's awesome. That's very unconventional, but we're glad that you decided to do that and are here.
Yeah, and for me, and especially with my family, we decided we wanted to get out of Omaha.
Yeah.
And Columbus is a great community for us to practice in. I knew my partner coming in, he and I were in residency together, and just has been a really good fit. We're very happy in Columbus.
Well, Dr. Cameron, thank you so much.
Yep, thank you, Grant.
All right, thank you guys for tuning in to another edition of Meet the Docs. Dr. Cameron, I'm Grant Otten. We'll see you next time.